We're seeing the same things we did last fall and winter, but it's in a much younger and much healthier population.
Well, we were in a good place. The transmission had slowed down. More and more people were getting vaccinated and protected. Hospitalization days started to really come down. Number of cases started to come down. And many of us thought that we were just in the last leg of this marathon. What changed was the vaccination rates just hit a wall.
We are very much in another wave. This is mostly due to the Delta variant. The Delta variant is the vast majority of cases in the United States, and they are here in North Carolina as well.
It is highly infectious, highly transmissible compared to the prior versions that we have seen. And it also results in sickness very quickly. So what we're seeing is the spread of the cases.
We have two variants that we're concerned about now. Obviously, the Delta variant is here. And there's a new variant out of South America, the Lambda variant, that we're significantly concerned about as well. It's like wearing your seatbelt. Your chances of being in an automobile accident are very low, but your chances of surviving that with a seatbelt are much greater. Your chance of surviving COVID are 25-fold better with the vaccine than without it.
I would say that vaccination is the most important tool and strategy we have to prevent serious illness and death from COVID.
It's the only lasting. And not only vaccinations, speed to vaccinations. This virus may be able to mutate faster than we can create new vaccines. Well, there certainly have been breakthrough infections, and we know they are much milder than those that are not vaccinated.
Some folks are using that as a reason not to, because they believe, well, I'm going to get the infection anyway, then why bother with the vaccination? The most important protection that the vaccination provides is you're less likely to get serious illness or death.
I think the most important thing to understand is this. There have been some very small number of complications from the vaccine. And that is a one-time event that occurs after the vaccination. Your risk of dying from COVID if you're not vaccinated continues day after day after day after day until this pandemic is over with. The concern I have for us going forward is the number of patients that we're seeing with what we now, it has been called by the press as chronic COVID or post-acute COVID syndrome. It's a syndrome associated with extreme fatigue, dyspnea, inability to catch your breath when you do anything. And the real scary one is a significant decrease in your ability to think clearly.
I think people believe somehow out there that they will escape this virus. And that, now understanding what this virus is about, that is just not a thought rooted in reality.
I don't want people to just throw their arms up and give up at this point. We've got to stick in this battle because it will not go away unless we do this.